we have MMC Digestive Surgery Specialist, Dr. Febiansyah Ibrahim. Good morning, doctor. Thank you for coming here.
Good morning.
All right, so let's get right to it, right? So first of all, can you explain a bit about what appendicitis is?
Okay, the appendicitis is a condition, illness, is that appendix that inflammation or infection. The cause can be the infection is can be caused by bacteria, viruses, parasite, or even cancer.
Okay. Let's paint the picture a little bit for those that aren't familiar. So we have our colon system there, right?
Yes.
And our appendix is basically, somebody explained it to me, it's like a little tip of your pinky. It's this tiny little thing that actually just extends out from your colon. Is that correct?
Yes, that's correct. It extends from the first part of the colon.
Okay.
Like the first part of the colon, we call it cecum.
Okay.
And this, the appendix is right through the...
Right. So someone also explained to me that there is not even a need for this appendix. Basically, we can have it removed and we can still function like normally as human beings. So this is something that some people do to avoid appendicitis. But usually when something goes wrong, it's usually because bacteria gets trapped in there and then it starts getting infected. Is that right?
Yes. So the most commonly caused the appendicitis is because the block of the lumen of the appendix.
Okay.
So the bacteria or stool, feces that come into the lumen of appendix cannot be going out to the colon.
Right. So what causes this blockage then, Doc?
The cause of blockage is the most commonly is hard stool.
Okay.
The hard stool that came into the lumen of the appendix, then they come out, and then they getting hard in there.
It's stuck.
And making a blockage.
Okay.
And then the bacteria grows and then make
So it's either rupture
infection.
or
Infection. And the infection causes it to rupture.
Oh,
because it
Yeah,
starts
the
getting inflamed.
infection caused the rupture.
All right, so diagnosing for appendicitis can be very tricky, just like Paul's story. So how is the appendicitis is actually diagnosed, and is it tricky because there can be symptoms that are similar to it?
Yes, yes, it will be tricky part. The appendicitis diagnosed by the clinical judgment, about 80%. So the clinical, what is clinical judgment? It's clinical judgment that doctor do from the history of patient, the history of the illness, what the complaint of the patient, and then since when, and blah, blah, blah. And then the most important is physical examination on the abdomen.
Okay.
And then after that, we can do like a blood work for getting result of the leukocyte to know the condition of the infection. And then if it's still tricky, we can do the ultrasonography. The CT scan is very useful.
Okay.
If the clinical judgment still unclear.
Right, so that's the thing. Most of it is an educated guess, right, Doc? I mean, you as an internist specialist in this field, you would have to get as much information as possible. So
Yes.
would it be safe to say then the doctor that misdiagnosed me the first time, he just didn't get enough information? Because I told him the type of pain I was in. I experienced it starting from my right lower side, which is appendicitis, where you would normally feel that pain. But he didn't actually do any further testing. I don't remember getting any blood work done. He did x-ray me, but more on my upper body cavity area, so not even examining my lower, because he suspected maybe it had something to do with my lungs. And then he didn't offer a CT scan, and at that point he said it was, I don't know the English term for it, he said sakit mah mungkin.
Dyspepsia.
Right. So he said, don't worry, you just need to take some Panadol, which is just basically painkiller,
Yeah.
and then sent me on my way. So again, is that the safest way then? It's to suggest somebody just get a CT scan if you're unsure?
CT scan, because the clinical of appendicitis is usually if the patient is man, it's usually not too difficult to diagnose the appendix.
I see.
If the patient is a woman,
Right.
then it's very tricky because they have a gynecological area there.
Right, right.
That's the symptom of the gynecologically is the same of
Can
to the-
overlap,
yeah,
right?
can overlap the appendicitis.
Oh, I see.
But for men, I think most of them is not very difficult. If the history, the pain is normally from the upper region first, and then they radiated to the right lower quadrant of the abdomen,
Right.
and they stay there.
Okay.
And then they have anorexia, like you said, you cannot eat something like
Yes, it's rejected.
and it commonly suddenly. So when you got working out,
Right.
and then suddenly
It's a
the pain.
sharp pain.
Yeah,
Okay.
suddenly. Suddenly is the most common pain of abdominal that suddenly is commonly caused by appendicitis.
Yeah, I think that's usually the case, right? Somebody feels a sharp pain, and then it's very disabling, and then that's when the sign of your appendix bursting. But in my case, it didn't burst. That's the whole problem, and it was more of a gradual buildup of the pain. So listen, Doc, before we continue our discussion, we have our colleague Marissa, who's also going to share with us some common myths about appendicitis. Marissa?
Yes, that is indeed correct, Paul. Hi, Dr. Feb. Hi again, Rasha, of course. Here, we're going to present 5 findings, and we would like to know which ones are factual and which ones are myths. The first one is, boom. So, Dr. Feb, is it true or not? If not treated promptly, the appendix can rupture.
Yes, like Paul experience. Yes, because on the story about the illness, about 48 to 72 hours, if not treated well, the appendix commonly going to rupture.
2 to 3 days. That's not
Yes,
a long
2
time.
to 3 days, if not treated properly.
I went way past that.
Yeah, so your
my
situation was
God.
actually very, very unique.
It was actually, very, it was quite dire.
Right.
Right. Second one. Whoop. You can treat appendicitis with antibiotics. Is that true or false?
It's a little bit 50-50. Because the antibiotic can reduce the inflammation, but did not cure the blockage.
Right.
Yes.
Right.
So it can be like health sembuh,
Heal.
healed,
Yes, correct.
but it will become again. Like it gonna be chronic.
Yes.
Chronic appendicitis.
Oh, no.
From the acute appendicitis going to be chronic appendicitis.
Okay. So the best thing, so the solution would be a
Operation.
surgery.
Surgery is the first.
Right. Which is routine, right? It's actually a simple surgery, is it not?
Simple.
Okay, no. I say that like I'm a doctor. There is no such thing as simple surgery.
Yeah.
It's routine surgery.
Routine surgery.
Right.
That's a
Routine.
simple surgery.
Arthroscopic, is it? If I'm not mistaken, you can actually use a scope, right? To,
Yeah, we can do now laparoscopic.
Okay.
Laparoscopic surgery.
So it's not that invasive in a way.
Not
or is
supposed to
it?
be. Yeah.
Okay.
It's supposed to just leave a little scar, not like my huge one that I have.
Yes, exactly. All right, the third finding is healthy diet and enough exercise can reduce risk of appendicitis. Is that true or false?
Oh, I want to know this
Oh,
one.
yeah.
So we cannot prevent to get the appendices.
Okay.
But we can reduce it maybe. Some of the literature is mentioned that high dietary fiber diet can reduce
The blockage?
Yes, can reduce the blockage because the stool when we eat dietary fiber, the stool did not will going like still moist, not
Right.
and then,
Not that
You'll be
hard.
more regular, right?
yeah, and then the bowel will be more regular, did not and then so that the dietary fiber is maybe one of the can be done to prevent the appendicitis.
So can I extend an extension to Marissa's question then? For somebody who's on something like a keto diet, where they eat a lot of red meat per se, is that actually can put you at a higher risk for appendicitis because that actually takes longer to process?
Not really,
Okay.
not really. It's just because it's just one.
Okay.
But we cannot prevent
There's a lot.
we can get the appendicitis.
Okay, that's what I've heard because people will always say all the time, well, perhaps you weren't eating very healthy. I ate a balanced diet. I'm not as healthy as I am now,
Yes.
but I started to think, like, what did I eat before this happened? But I
Yeah.
don't think you can actually prevent it, right?
Yeah,
Something
you
can't just
cannot.
get stuck there.
Yeah.
Right, okay.
Right. Okay. And the fourth one, this is one of my favorites actually.
Okay.
Because this is so Indonesian. Instant noodle. So eating instant noodle may cause appendicitis.
No.
Is that true or not?
No.
Oh, thank
It's
goodness.
a hard
Free choice. Let's have some instant noodles after this. Right, okay. So this is often a myth when it comes to Indonesians. Why? Is it because people think noodles are just going to sit in your system?
I don't know because the noodle is one of the type of food. So
Yeah, it's nothing. It's just like any other food.
Okay,
Yeah, like-
so it's a myth, people.
Okay, yeah.
It's a myth. You can still have your instant noodle once a month. Okay? Once a month.
Just once a
Yeah,
month.
right.
That's what I tell my
Marissa.
daughter.
And the final one. This is also a favorite because I actually heard this myself. You see the seeds in this jambu, in this guava, and the thing that I heard was not actually the seeds from guava, but the seeds from cabai rawit or bird eye chili.
Yes, bird eye chili.
Yes, exactly. So fruit seeds or bird eye chili seeds, if undigested, it can cause acute appendicitis. Is that true or not, doctor?
no, I think so because in my experience after I do a lot of appendectomy and I open the appendix.
You didn't find any
You
seeds
didn't
in
find
there?
any. Yes. Maybe
Okay.
because like maybe chili or like watermelon or guava, it already
Broken down, right?
broken down from
the
the
acids.
stomach. Yeah.
Right, okay. Just like
Maybe if you eat a lot, very a lot of like guava, maybe.
Maybe.
Right.
Maybe.
Okay, so
Take
this
a lot.
one, myth busted. There you go.
Thanks for
Thank
those,
you,
by the way, because a lot of those were related, again, to my incident. The night before this happened, I had actually, I'll be total transparency here. I consumed a little bit of alcohol. I also had dim sum with my meal. And you know how they have that soy sauce with the chili that you
Oh,
mentioned?
yes.
And not long after that, a few hours, that's when I started feeling the pain. And I always wondered, is it
I think
because
that's
of the seed?
psychosomatic, no?
It was just coincidence.
Or
That's
maybe
what I
it's
happened.
actually triggers something that has already been there.
Can,
right?
can it be a trigger? No, right?
No.
No. See, it was just bound to happen anyway. And a lot of times, I did reanalyze. I went, in retrospect, I thought about things I did, and my friends would all say, maybe it was the alcohol that you drank that night that triggered it. Maybe it was those seeds that you had with the chili.
Maybe,
So,
maybe.
Maybe. Now that you know, it's just a myth. Thanks,
Yeah.
Marissa.
Okay, thank you. Thanks, Dr. Feb.
Thank you.
All right, so let's talk about solutions for appendicitis. Basically, we've talked about the removal of the appendix. You mentioned that a routine scope surgery would most likely do the trick. However, there's other situations as well. Can you explain some of it?
Okay, about the treatment, of the
Yes,
appendicitis.
correct.
So we do the appendectomy.
Okay.
The conventional appendectomy, which we do incision about 5 to 10 centimeter
Okay.
on the right lower quadrant. And then now we can do the laparoscopic surgery that we do 1 centimeter incision only and half centimeter to 2 incision of half centimeter on the abdomen.
Okay.
But it still depend on the condition of the appendix, like when already perforated. So we can or the still 1 day acute. It depend on the condition.
I guess the severity, how
Yeah.
how severe it is already.
Yeah.
Okay.
Actually, in relation to that, can appendicitis cause serious complications if treated late or if not detected at all?
Yes, like Paul experience. Yeah, it's the complication is like rupture. The rupture can cause the content of the bowel that not supposed to be in the abdominal cavity going there. It's going make the infection to the whole your body.
Oh,
Okay.
They call it sepsis.
Yes.
Yes, and sepsis lead to the death.
Okay.
wow.
Yeah, if not treated properly.
Okay.
So that's the serious complication
Right.
of the appendicitis.
So basically what's happening is these poisons and these toxic fluids are getting around inside my body
And
they-
then going to
Through your bloodstream.
through your
Right.
bloodstream.
and eventually hitting all our vital organs as well.
Yes.
So would you say that whenever we feel a hurt or a stab around that area, which is on the right side of the stomach or the body, we need to get checked into the doctor immediately as soon as possible to ensure that at least we don't get diagnosed for appendicitis. Is that
Yes.
correct?
Yes, that's correct.
Okay.
It's really correct. So if sudden pain on the right lower quadrant abdomen,
Okay.
usually from the epigastric area or navel area,
Okay.
and then you must come to seek to the doctor.
Okay. That's the first sign, and definitely don't wait because you don't have
Yeah.
much
Don't
time
wait
after that.
because
Yeah.
it's sudden.
Right.
So it will be mengganggu pekerjaan.
It will
Yeah.
bother your work.
Yeah, or
your
bother
daily
your
life.
activity or
Actually,
something.
I have two
life.
friends who actually had their appendix burst, and both of them were very similar situations where they were actually working. They were DJs,
Right.
so they couldn't even finish playing. They had to
Exact-
actually
oh.
stop because it was just so painful. Somebody else had
Yeah.
to take over, and they went immediately very pale.
Right.
Yes.
Right, that's usually another sign as well.
Yeah.
And it's very difficult to drive because it's on your right side,
Yes.
and that's the side that you
Yeah.
use your gas. So
Really,
likely you might have to get some help driving you
Yes.
to the hospital.
So you need to be very head on, reacting. and
Listen to
just
the
doing
signals.
work.
If your body's
Exactly.
telling you something, listen.
Exactly.
Yes.
Doc, thank you so much for your time and this
Thank you.
more
Thank you
in-depth
so
look
much.
into appendicitis. And we hope that you're able to get some insight and some good information from this because we certainly did. We're going to take another short break here, but don't go